positive behaviour therapy? Positive behaviour therapy focuses on understanding behaviour as communication and improving quality of life, rather than controlling behaviour. Positive behaviour support helps people by exploring why behaviours occur, strengthening communication and emotional safety, adjusting environments and routines, teaching skills that meet real needs. PBS is person-centred, rights-based and designed for long-term well-being. Positive behaviour. Therapy for autistic people. For many autistic people, behaviours of concern reflect unmet needs, stress or overwhelm, rather than intentional behaviour. Positive behaviour support responds to these underlying experiences. PBS can support autistic people by reducing sensory and environmental stress, supporting communication in different forms, building emotional regulation and coping skills, increasing predictability and daily confidence. The goal is safety, understanding and participation, not changing who someone is. Key principles of positive behaviour. Support. Positive behaviour. Support principles ensure support is ethical, respectful and effective. Key PBS principles include understanding the function of behaviour, being person-centred and strengths-based, using proactive preventative strategies, teaching replacement skills, applying least restrictive practices, working collaboratively across environments. These principles protect dignity and support meaningful change. PBS versus other behavioural therapies, including ABA. While PBS and ABA share some learning principles, they differ in how they prioritise dignity, choice and quality of life. When comparing approaches, consider whether behaviour is viewed as communication, how strongly dignity and consent are prioritised, the role of environmental change, whether quality of life is the main outcome. Under the NDIS, PBS is the recognised and regulated behaviour support framework. How the NDIS funds PBS for autism. Positive behaviour. Therapy for autism is commonly funded through positive behaviour support under the NDIS funding, aims to support safety, participation and well-being in everyday life. NDIS funding may support behaviour support assessments, development of a PBS plan, training for families and support workers, ongoing monitoring and review. Funding decisions are based on goals, functional impact, evidence and reasonable and necessary criteria. NDIS positive behaviour. Support plan. A positive behaviour. Support plan is a personalised guide that explains how to support a person safely and respectfully across daily life. It is practical, collaborative and centred on the person. A PBS plan usually includes why behaviours occur, triggers and early warning signs, preventative strategies, skill-building supports, calm response guidance, review and monitoring processes. Plans evolve as needs, environments and skills change. For autistic people, positive behaviour therapy focuses on reducing distress by improving understanding, communication and supportive environments. What happens in PBS sessions? Positive behaviour. Support sessions are designed to feel practical, supportive and respectful. They focus on everyday life, rather than clinical settings alone. Sessions may involve observing behaviour in familiar environments, practicing communication or regulation strategies, using visual supports and routines, coaching families and support teams, adjusting environments to reduce stress. Progress comes from consistent shared practice between sessions. Choosing an NDIS behaviour support practitioner. Choosing the right behaviour support practitioner is about finding someone who feels respectful, collaborative and aligned with your values. When choosing a practitioner, consider whether they understand behaviour as communication, have relevant life stage experience, follow PBS and NDIS principles, communicate clearly and openly, work collaboratively with your support network, next steps and getting support. If behaviours of concern are affecting daily life, it's okay to seek support and take things one step at a time. Support does not need to be rushed. You may choose to speak with your GP or allied health professional, review your NDIS plan and goals. Talk with a support coordinator or LAC contact a PBS provider for a conversation. Starting with information can reduce stress and build clarity. How Affective Care can support you. At Affective Care, positive behaviour. Support begins with listening and understanding lived experience. Our approach is emotionally centred, person-led and NDIS-aligned. We support you through collaborative PBS planning functional behaviour assessments, practical, everyday focused strategies, ethical behaviour support plans, ongoing guidance and review. We work at a pace that feels safe, respectful and right for you. Ready for a supportive conversation? When you're ready, Affective Care offers a supportive, no-pressure conversation where we listen first and take the time to understand your situation. We provide clear, honest guidance about positive behaviour support and NDIS pathways, always respecting your values and pace. You're welcome to reach out for a calm, supportive conversation to explore whether positive behaviour support feels like the right next step for you or your family.